Certain groups can be more vulnerable to the virus, such as those with underlying problems like heart disease and diabetes. And age is a major factor too. Take a look at this graph showing mortality rates from known cases across the world. At the very far end are the older age groups, and you can see the taller groups and the taller bars representing the higher rates of death. But as you come this way, towards the younger age groups, the bars get smaller, quite dramatically so, and that shows the vast majority of younger patients survive. Well, it is, of course, still a worrying time, particularly for those vulnerable groups. So what's being done to keep them safe? Layla Hayes has been investigating.
At the Bulsmoor Lodge care home in North London, they're doing a deep clean. The residents here are aged from 80 to 101, and staff are doing everything they can to protect them from the coronavirus.
We've got the housekeepers doing extra cleaning. Obviously, they have to do all doorknobs, lifts, plug sockets. We've got our carers, as well as the housekeepers, and any management that come in, they have to clean their hands more often. But obviously, we've got to try and sort of like work through it if it was to happen.
How are you this morning?
Yes, not too bad at all.
Edith Martin is 90, but says she isn't worried.
Well, they clean everything. They're so clean. Every morning they do it, and even afternoon they hoover and clean everything.
And does that reassure you?
I'm sure they can't do any more.
The government has recommended social distancing to prevent the virus spreading, but carers here say that's easier said than done.
I don't think it is possible not to touch the residents because we are hands-on carers and the resident is also hands-on with us. It would be impossible. How can we tell a resident, when they ask us for a hug, we cannot give you a hug? That is sometimes heartbreaking, so we can't, it's not going to happen.
GP surgeries like this are on the front line, and if the virus does spread, the government says recently retired doctors and nurses could be called back to work. But that will bring its own challenges.
Some of us get a little bit slower with age, albeit we gain some experience. This will not be easy. My colleagues who choose to do this cannot possibly be expected to do the sort of number of consultations that some of my currently working colleagues do, perhaps as many as 100 patient interactions in a day.
The elderly are likely to see the biggest impact from the virus. Preventing them getting it should now be everyone's priority. Layla Hayes, 5 News.